Hey, if you've ever been told you have diverticulosis or you're worried about diverticulitis, this video is for you. These two words sound almost identical, and honestly, most people, even after their doctor tells them, walk out of the office still not totally sure what either one means. So today, we're going to break it down simply, clearly, no medical jargon. I'm Dr. Francis Horenstein. I'm a gastroenterologist in Columbus, Ohio, and I see patients with diverticular disease all the time. Some of them are scared, most of them are confused, and a lot of them didn't need to be either. They just needed someone to explain it properly. So let's do that, and I'm going to cover what diverticulosis is, what diverticulitis is, and how to tell the difference, what symptoms to watch for, and most importantly, what you can do right now to protect yourself. Let's get into it. Okay, so let's start with diverticulosis because this is the one most people have and don't even know it. Diverticulosis is when small pouches, we call them diverticula, form in the wall of your colon. Think of it like a tire with a weak spot that bulges outward. These pouches develop over time, usually because of pressure in the colon. And the number one cause of that pressure? Not enough fiber. When stool moves too slowly or you're straining, the colon has to work harder. And over years, that pressure creates these little pockets. Here's the little thing most people don't know about. Most people with diverticulosis have zero symptoms. None. No pain, no bloating, nothing. A lot of patients find out they have it during a routine colonoscopy and they're completely shocked. It's incredibly common. We're talking more than half of adults over 60 have diverticulosis. So if you've been diagnosed, take a breath. Having diverticulosis does not mean you're sick. It just means your colon needs some extra attention. And we'll get to that later. Now, diverticulitis is a different story. And this is the one you need to take seriously. Diverticulitis is when one of those pouches gets infected or inflamed. That itis at the end, that's the giveaway. Appendicitis, colitis, diverticulitis. The itis always means inflammation. When a pouch gets inflamed, it can cause real problems. Pain, infection, and in more serious cases, tearing or blockage of the colon. Now here's the good news. Only about 5% of people with diverticulosis will ever develop diverticulitis, so the odds are in your favor. But when it happens, it is not subtle. You'll know something is wrong. And the key is knowing what to look for so you can act fast. Which brings me to the next section. What does diverticulitis actually feel like? Here are the main symptoms to know. Number one, pain on your lower left side. This is the classic sign. It usually comes on pretty quickly and can be sharp or achy. Sometimes people think it's a muscle pull. It's not. Number two, fever and chills. Your body's fighting an infection, so it's going to respond. A fever alongside abdominal pain is always a signal to call your doctor. Number three, nausea and vomiting. Your gut is inflamed and it's going to let you know. Number four, changes in bowel habits. This could be constipation, diarrhea, or going more or less than usual. Number five, pain that gets worse when you move or press on your belly. That's inflammation responding to pressure. If you have these symptoms, especially fever plus left-sided pain, please don't wait. Call your doctor or go to the nearest emergency room. Caught early, diverticulitis is very treatable. Caught late, it can get complicated. Okay, so now the part that actually matters most. What can you actually do? The single most important thing you can do for your colon is eat more fiber. I know you've heard this before, but I want to explain why it matters here specifically. Fiber keeps stool soft and moving. When it moves easily, there's less pressure on the colon wall, and less pressure means fewer pouches. It's that simple. Aim for 25 to 35 grams of fiber a day. That's fruits, vegetables, legumes, whole grains. Not a supplement you take and forget. Real food. Second, drink your water. Fiber without water actually makes constipation worse. So you need both. Aim for at least 6 to 8 glasses of water a day. More if you're very active. Third, move your body. A 20-minute walk after dinner does more for your digestion than most supplements on the market can do. Regular movement keeps your colon working the way it should. And fourth, don't strain. Chronic constipation, ignoring the urge to go, sitting on the toilet for far too long, all of that increases pressure in the colon over time. Listen to your body. These aren't revolutionary tips, but they work, and your colon will thank you. Before I wrap up, let's talk about when to actually pick up the phone. Call your doctor or come see us if you have any of the following: left-sided abdominal pain that doesn't go away, fever alongside stomach pain, any fever, even if it's low grade, blood in your stool, bowel changes lasting more than a few weeks, and if you're over 45 and haven't had a colonoscopy. That last one, the colonoscopy, is actually how a lot of people find out they have diverticulosis in the first place. It's a routine screening. It doesn't take long and it can catch things early when they're still easy to treat. So don't put it off. All right, that's diverticulosis and diverticulitis. The difference, the symptoms, the prevention, and when to get help. If this was helpful, please share it with someone who needs it, because so many people are walking around confused about this, and they don't have to be. I'm Dr. Frances Horenstein at Digestive Health here in Columbus, Ohio. We're here when you're ready. Drop your questions in the comments because I read them, and I'll see you in the next video.